I've just entered my patient's room. I've closed the curtains and the door, and I've completed hand hygiene. So, hi, my name is Cameron. I'll be your nurse today, and I'll be doing your head-to-toe exam. Is that okay with you?
Yes.
Okay. And I'm going to ask you what his name and date of birth is. So, is your name and date of birth?
Colficken, June 23rd, 1999.
Okay. And what did you eat for breakfast this morning?
Eggs and bacon.
And who was the president whenever you're in high school?
Barack Obama.
Okay, so my patient is alert and oriented. His speech is not slurred. Alert and oriented times 4. Don't see any involuntary movements in the face yet. So I'm going to move on to inspecting his hair for any infestations, lice, masses, tumors, anything like that. And alopecia, any tenderness, Cole?
Nope.
Okay, so sometimes you can see pressure ulcers or alopecia in patients who have been bedridden. So I'll take those off, perform hand hygiene. Then I'll move on to the skin on the face and making sure that there's no abnormalities. Can you smile for me, Cole? Okay, so his face is symmetrical, no paralysis in one side, which is a good sign. So I will move on to making sure that there's no mass or sores, lesions, stuff like that. So then I'll move on to the eyes and making sure that they are round and equal, which they are. The pupil size is about 3 millimeters each. The sclera is white. The conjunctiva, will you look up please, is pink, no signs of redness or extra discharge in the eyes. I'm going to check the reaction to light, make sure that they constrict, and they do. And they do, and now I'm going to check accommodation, so if you could watch my pinhole. And watch in. Okay, so his eyes were accommodated. So I could also check the nose for the mucosa and make sure that it is nice and pink and moist, and for any polyps or anything like that. So I could also put on some gloves again and look into the patient's mouth. And I'm looking for any tooth decay, anything like that. You could open up for me, making sure that the tongue is nice, pink, and moist. Checking checking the tonsils to make sure that they are nice and not inflamed or anything like that. So 1+. I'm going to check the mucous membranes of his mouth. And there's no cyanosis there, so it's a good sign. So I'll take those off and perform hand hygiene. And I could also check, if I had an otoscope, I could check for the tympanic membrane to make sure that it's a pearly gray. I could palpate the ear to make sure that there's no masses or abnormalities. Same thing on this ear, no discharge or anything like that. So I could also move on to taking the temporal pulses. And it's a 2+, they are present, no problems there. So now I'm going to go down to the throat and thorax region. So I'm going to begin by looking to make sure that the trachea is in the middle of the neck. And I can also, if I look over here, I can see the carotid pulsate, which I don't see any bounding or extra movements there. So I could first auscultate his carotids with the bell. If you can move that way just a little bit. Looking for a bruit or anything like that. And then the other way. And no problems there. And now I'm going to palpate the carotids. And 2+ there. And then on this side, 2+ there. So no problems. Now I'm going to inspect the chest thorax region. I'm going to perform skin turgor over the clavicles. It's nice and brisk, so no problems there. The clavicles are nice and symmetrical, as well as every other feature on his body. I don't see any abnormal coloring or lesions, scars, marks, anything like that, obvious masses. So now I'm going to palpate his chest for any air trapping masses, lumps. Do you have any tenderness, Cole? Okay. So no tenderness there. So now I could check for thoracic expansion and tactile firmness. I don't see that he's using any intercostal or extra intercostal muscles for breathing. His breathing is unlabored. So if you could breathe in and out for me. And thoracic expansion is normal. Now, could you say 99 every time?
99, 99, 99, 99, 99,
Sorry.
99, 99, 99,
And then
99, 99.
Okay, so no abnormalities there. And now I can percuss using the same ladder method. Once laterally. Okay, so no abnormalities there. Now I can auscultate for respiratory sounds. So if you could breathe in and out for me, Cole. Okay, and then I'm going to go once laterally. Okay, so no crackling or abnormalities there. Now I'm going to change him to the back side so you can see this area. And I'm going to once again inspect. I do see that everything is symmetrical, scapula, upright posture, and spinous processes are equal. 1 to 2, transverse diameter, 1 to 1 can be seen with COPD patients. So I'll begin by inspecting. I do see a little bit of scarring right here, and what is that from, Cole?
Growth.
Everything's like healed, so there's no problem there. Other than that, I don't see any masses, lesions, sores, marks, or anything like that. So now I can palpate, make sure that there's no tenderness. Do you have any, Cole? Okay, so no masses or anything like that. Now I can percuss using the same ladder method. Okay, no problems there. And now I'm going to auscultate once again, 6 times on the back. You breathe in and out. In and out. Again. Okay, and no abnormalities there that I can hear, no crackling or anything like that. Everything's good. So now I'm going to switch you back this way, Cole, and we're going to do the cardiac landmarks. So I'm first going to go to the right sternal border at the second intercostal space for the aortic area, the diaphragm. Then I'm going to flip over to the bell. Then I'm going to go right across to the pulmonic, and then flip around to the bell once again. Then I'm going to go down to Erb's point. Flip around again for any abnormalities with the bell. Checking out here. And then to the tricuspid. Flip around. And then the mitral. Flip around with the bell. Okay, and I don't hear any abnormalities there. Normal heart rhythm, S1 and S2 are heard. No extra S3 or S4. So everything's good. Everything is even. The costal angle, ribs are good. So we're going to move down to the abdominal assessment. So if you could lay on your back for me, Cole. So I'll first inspect the region, umbilicus, make sure it's centered in your body. Make sure that everything, there's no like masses or lesions, scars, anything like that. So I'm going to start by auscultating in the right lower quadrant and going around clockwise, 15 seconds each. Oh, with the diaphragm and my stethoscope. Okay, and bowel sounds are active, they're not hyperactive or hypoactive. So now I'm going to move on to listening to the artery. So this is the aorta, with looking for any bruits with the bell of my stethoscope. And then the renal. The other renal. And iliac. Sometimes with skinnier patients or even skinnier women, you can see pulsating, but I do not see that on Cole here. So now I'm going to look for venous hums in the epigastric region and the umbilical with the bell of my stethoscope. Then I'm going to flip over and look for any friction rubs with the liver and the spleen. So this is the liver and spleen. No friction rubs there. So now I can percuss around his abdomen. You don't have any problems with your abdomen right now, do you? Okay. Okay. And if you could sit up for me and turn that way so I can show them the costovertebral tenderness test. Okay. Let me know if you have any tenderness. Any tenderness? Any tenderness? Okay, so no renal problems there. If you could lay back on your back again, Cole. So now I'm going to lightly palpate his abdomen for any masses or anything like that. Let me know if you have any tenderness whatsoever. Looking for any hard masses or anything like that. And then I would palpate deeply for the aorta, kidneys, spleen, and liver. But that completes the abdominal assessment. So, Cole, if you could sit up for me, I'm going to do the upper extremities. So I'm looking for symmetry in the arms and the skin, making sure that everything is okay there. Clavicles are symmetrical, arms are symmetrical, the skin is nice and even. There's no signs of like cracking or redness or anything like that. No abnormalities, masses, or anything like that. Sores or bruising. So now I can palpate the arms for any tenderness. You have any tenderness? Okay, I noticed that his arms are moist as well as his chest earlier, and yeah. So he's got warm extremities, which is good. I noticed that on his hands, he does not have any like noticeable joint abnormalities or anything like that. His nails, I'm going to look for clubbing, which I don't see in Cole. Now I'm going to do capillary refill, which was less than 2 seconds bilaterally. So no abnormalities there. Now I can check the brachial pulses bilaterally. And that's a 2+. And then the radial pulses bilaterally, which is a 2+. Ulnar pulses bilaterally, 2+ again. And then I can also check for edema in the arms. And I don't see any indentation or anything like that, so no problems there. Now I can test for muscular strength in the upper extremities, so if you could squeeze my fingers, Cole. Good, and then push against my arms and pull. Okay, so no abnormalities there, 5+ strength. Yeah, so we're good up on the upper extremities. Oh. Okay, so now I'm going to do the lower extremities, looking for any abnormal hair anywhere else, or like loss of hair anywhere where you can see with PVD patients. And I don't see that. I see normal, symmetrical legs, no lumps, bruises, masses, or anything like that. So I'm also going to feel for his popliteal pulses behind the knee, and that is a 2+. So no problems there. If I go down the legs, I can test for edema once again, and no problems there, no indentation or anything like that. So I can also put on some gloves because I'll be looking at the feet for any fungi or loss of toenails, anything like that, and which I don't see. So I'm going to be feeling for his posterior tibialis pulse bilaterally, which is the 2+, it's present, and then the dorsalis pedis pulses, which are both present bilaterally, 2+. And then I'm also going to check for capillary refill in the toes, which is less than 2 seconds, which is what we need. Now, if I didn't see a pulse in the feet, or feel a pulse in the feet, I would get a Doppler. So I will remove, so now I'm also going to test for feet strength. So if you could push down, okay, and then pull up. Okay, and no problems there. So I can now discard my gloves and throw them in the trash and perform hand hygiene. So now I'm going to assess the patient's gait. So if you walk over here, making sure that his hips are all in the right posture, and so just walking normal. Okay, and then you could go in front of each other, heel toe. Okay, and everything's steady and even for my patient. So I would lower the bed to the lowest position, make sure that the colli is within reach, and make sure that I perform hand hygiene. And yeah, so then that will be it. Thank you, Cole.